Over to you. Thank you. Good afternoon. My name is Allyson Krupar. I work as a distance learning officer at the Infectious Disease Institute in Kampala, Uganda. I work directly with rural health workers. Rural health workers face a serious problem of information deficit. So they don't have access to the information that's necessary for them to do their jobs effectively. They don't get updates on new technologies, new innovations in healthcare, in prevention of infectious diseases, in treatment. So what mEduText is using SMS and voice in order to reach out to rural health workers where they are. So a rural health worker would come in, they would have an evaluation and go to a training. They might have that training using distance learning tools. They would then either return to their facility or start getting SMS reminders daily about the content of that course. Then they would have weekly quiz questions to assess their internalization and experience with the course. That would be followed up by a call and then an evaluation. We're going to first focus on the prevention of mother-to-child transmission of HIV/AIDS. We're focusing on that because PMTCT is a serious issue when it comes to HIV/AIDS treatment. There are new WHO regulations as well as Ministry of Health Uganda regulations in terms of the care and treatment of HIV positive mothers. We have a 14.5% rate of new HIV cases in children, and most of that is because of mother-to-child transmission. So what we're doing is we're working with our partners to reduce that rate, to focus on government-run facilities, as well as Health Center 4, which is the highest level of a community health center in Uganda, and hospitals. We're also focusing on not-for-profit facilities and faith-based facilities. These facilities are using, they're aware of the continuing medical education challenges of their rural health workers. In fact, they're already working with us to get their rural health workers trained. But their health workers can't leave their location. So we're going to add some value to their training at their location. Since they don't have anyone to cover for their patients when they're gone, we're going to try to improve their PMTCT practice by 100%. This is feasible because the guidelines are new. And since the guidelines are new, it's going to take 100% in order to be able to enact those new guidelines. Also, we're going to identify the most effective tool, because right now we're assuming that mobile phones are useful in this way, but maybe we want to use voice calls, maybe we want to use automated calls. And IDI is the organization to do this. The Infectious Disease Institute has trained 5,000 people since 2002. We've done so in 27 sub-Saharan countries. We work with Makerere University, so we attract physicians from all over the world. These physicians, as well as our training team, has reached out to other organizations that are interested in using distance learning and interested in using SMS for distance learning. And we're already bringing those organizations on board to work with us. We're a capacity building organization, not just of health workers, but of healthcare organizations. So what we do when we reach out to our rural health workers is we give them the tools for them to do their job better. And we bring them into our IDI community. So those 5,000 plus, we already have contact with them. We already know who they are. They know the standard of excellence that IDI has. So once they have been brought into that community, we can bring them into the PMTCT program if they're in that field, or we can work with them on other fields. So we've designed our budget for this project, which is looking at specifically what ITU and other funders could support us with. We'll be looking at transportation for the evaluation, which is very important at this stage in the project, so we know what's working and what's not. We do some serious monitoring, as well as the technology startup costs. So we're using an SMS platform, we're using voice calls. We want to make sure that those things are not charging our health workers. We want to make sure it's tested before we include it in the tuition costs. And who's going to be doing this is the IDI Learning Innovation Center. Myself, I am a Global Health Corps Fellow. I work with another Global Health Corps Fellow named Raymond Bissiga. I'm an educator of 9 years experience working in adult education. He's a software developer of 5 years experience working in Uganda. Both of us, combined with the Learning Innovation Center, which has a telecenter already doing AIDS treatment, as well as some other services that are combined with the SMS and the voice calls, we can scale up throughout sub-Saharan Africa, not just focusing on PMTCT, ranging out to other programs. What we're looking as rural health workers really need support where they are so that they can really do their job effectively, improve their clinical practice, and in the end, they can save lives. So I thank you for your time, and I look forward to your questions.